Hi, my name is Jamie. The 6 rights of medication are right medication, right patient, right dosage, right time, right route, and right documentation. This is the MAR of Miss Millie Larson. Date of birth is 1/1/1936. She has no known allergies, so it is now 8 a.m. Miss Larson is due for furosemide 20 mg, and this is the IV push, which is every 12 hours, and it's administered over 2 minutes, and it's flushed with 3 milliliters of normal saline before and after each dose. So this is due now, which is at 8 o'clock, and it's for edema and blood pressure. The second medication for Miss Larson is the insulin, which is the Lispro 10 units, which is given subcutaneous with breakfast, and it's due now as of 8 a.m. to control her blood sugar. So she does not have any allergies, which I just verified. I am going to wash my hands. I'm going to gather the supplies I need. I have the IV stuff here. I have a needle, which is the 25 gauge 5/8 inch needle. And also I have the 3 ml syringe. I'm going to make sure that the needle is not expired. It is not. It's 4/30/2026, which is good. Put that to the side. And I have some alcohol pads. I have some gauze right here. And I have the medication vials. So I have the furosemide, and this is 100 mg. It's the 10 ml multi-dose vial. So the order states 20 mg is needed. So this is 10 mg over 1 ml. So I'm going to draw up 2 ml of the furosemide for Miss Larson. I also have here the insulin Lispro, which is Humalog, and this vial has 100 units per ml, so I only need 10 units from here. And the expiration date is good. It's 4/2031, which is good. And let me just double check the furosemide. The expiration is good as well. It's 10/2029. Good. All right. I also have the saline flush. This is the 10 ml. I'm going to use this before and after giving the furosemide. All right. So now I'm going to just, I also have the insulin syringe, which is the 1 ml 29 gauge, and that's half an inch, and this is only for insulin. And I have some tape here. All right, so I'm just going to draw up the medications. I'm going to start out with, I'm just going to wash my hands one more time. All right, I'm just going to first draw up the insulin, which is, let me just double check here, the Lispro, and that's the 100 units per ml, looking at the expiration date, which is good. All right, I need to draw up, looking at the MAR, that's 10 units subcutaneous with breakfast. So I'm just going to open the top here. This. I'm just going to aspirate for air for 10 units. Good. I'm going to check for any air bubbles. We don't want any air bubbles. All right, good. And one-handed technique. Tap it, put it to the side, put this in the garbage. All right. Now I'm going to use my tape. And this is 10 units of Liss Pro. I'm just going to put that to the side, put this to the side, and now I'm going to draw up the furosemide. So double checking the MAR. The MAR needs 20 mg IV push, which is 2 ml. If I do the calculations, we have 10 mg over 1 ml. So 20 mg would be 2 ml. So just gonna open this, back to the side, grab the syringe, make sure I'm not touching the top. It's the aseptic technique. I'm just gonna twist the needle in. And we only need 2 ml. All right, so 2 ml. Just going to place this in here, push in the air, and now I'm gonna just draw up 2 ml. All right. And one-handed technique. And now I'm just going to label that I have 2 ml in here of the furosemide. All right, I'm gonna put this to the side. Okay, this is garbage. All right, so I'm just gonna gather the rest of the supplies. All right, so this is garbage. Put that in the garbage. All right. Got my safety thing here. I'm just gonna wash my hands again. I'm just gonna bring all the stuff back into the room. Okay. All right, I'm gonna knock on the door. Good morning, Miss Larson. My name is Jamie. I'm one of the nurses here. I'll be giving you your morning medication. Is that okay? Can you state your full name and date of birth? Okay. Just going to check your wristband. Make sure Millie Larson. Date of birth is 1/1/1936. Good. All right. So, I will be giving you your insulin injection on the right side of your stomach, this area right here, and a medication using your IV line on your arm. Is that okay? Okay. So now I'm just going to raise the bed, make sure she's very comfortable. and have her in an upright position. I'm just going to verify the medications again. So I have here furosemide 20 mg, IV push every 12 hours, administer over 2 minutes, flush with 3 ml of normal saline before and after dose. And then the Lispro, which is the insulin, 10 units subcutaneously with breakfast. And both are due now at 8 a.m. And she has no known allergies. All right, I'm just going to verify the medications that I have here. That's the 10 units of Lispro and the 2 ml of furosemide. All right, so I'm going to start out with your insulin. So I'm going to pinch the skin like this and just inject it. So since Millie has been losing weight, I'm going to go in a 45-degree angle, not a 90-degree angle, and I'm going to do it in a darting motion. So first I'm just going to wash my hands. Make sure I have all my supplies where I need it. Put on some clean gloves. And how are you doing today? Good. All right, so once you have this insulin, you can have some breakfast, okay? I know your breakfast is waiting, I'm sorry. All right, so just gonna clean the skin in a circling outward motion, like that. I have some gauze here. I'm just going to open up the gauze and put it to the side. All right. 10 units of Lispro subcutaneously. All right. Cap. Just going to pinch the skin and go in a 45-degree angle. Ready? All right, just gonna gently, and then put the safety guard up. Place this in here, and I'm just gonna place some pressure. How are you feeling? Okay, good. All right. So this is garbage. All right, so now I'm just going to do your IV medication. So I'm just gonna use the alcohol pad. And I'm just gonna clean this for about 5 to 10 seconds. I'll move this over here. Okay, garbage and garbage. All right, so this is a saline. I'm just going to put 3 ml into the IV. All right, so first I'm just going to aspirate to see if there's any blood return. And there's no blood return, so it's good. And just make sure that the IV site, there's no redness, there's no itching. Patient's not complaining about pain or anything, so that's good. So now I'm just going to inject 3 ml of the solution. Good. I'm just gonna undo it and put it to the side where there is I won't contaminate it. So I'm just going to put it to the side, not having the top touch anything. And now I'm just going to verify 2 ml of the furosemide is going to go in. So I'm just going to remove the needle from the syringe. And I'm going to place this in here. Okay. And now I'm just going to place this, screw it onto the hub of the IV port. Okay. And now I'm just going to inject this for 2 minutes. So very smoothly for 2 minutes. So for that, I'm just going to sit down and I'm just going to slowly inject it. So for demonstration purposes, just gonna go a little faster. All right, so 2 ml is in. I'm just going to unscrew this, dispose it in the safety, and I'm gonna place the saline solution back here, and I'm gonna flush again 3 ml as per the MAR. Okay, just gonna unscrew that. Okay, I'm gonna put this to the side. All right, so Millie, is there anything else you needed other than your breakfast? All right, so I'm all set for this morning. If you need anything, let me know. I'm just going to place the bed in the lowest position, and if you want to have your seat upright for your breakfast, that's totally fine. I'm just going to make sure your call bell is in reach, and have a nice day, okay? Okay. All right, so I'm just going to take my gloves off and put on the garbage. Just going to wash my hands. All right. All right, so now I'm just going to document in the MAR that the furosemide was given. I'm just going to initial here. And it was given at 8 a.m. And it was IV. And the site before and after, there was no redness, there was no swelling. Patient wasn't complaining of any pain, which is good, before and after. Vital signs were stable. The Lispro I gave to the patient subcutaneously, and it was in the right lower abdomen, so like right lower quadrant. And I'm just gonna initial there. And the site was, there was no bruising, there was no pain or anything, so just gonna indicate that as well. I'm just going to sign, initial, and that's about it. Thank you.